Hey everyone, this is Susan with NRSNG. Today we will be working through a care plan on diabetes. To see our massive free database of nursing care plans, just visit nrsng.com/nursing care plans, and you can also download the free editable PDF care plan template that I am using right here at nrsng.com/care plan template. So let's dive into diabetes. So for this particular care plan, I'm assuming that the patient is coming into the hospital due to lack of care or lack of control of their diabetes, or diabetic complications. So my first nursing diagnosis is going to be non-compliance related to diabetic maintenance as evidenced by uncontrolled glucose levels. So this could be that they are not taking their insulin like they should, or any of their oral diabetic medications as they should. It could also be that their diet is not being followed, counting carbs, counting sugars. It could also be something related to it, like they are sick, and which can cause your glucose levels to be imbalanced. So lots of reasons why it could be uncontrolled glucose levels. My next nursing diagnosis is a risk for unstable glucose related to diabetes. Now, when it's a risk, we don't do the related to's and we don't do the as evidenced by, because it's not actually happening. It's a risk for that, but the patients are at risk for further unstable glucose because they are being hospitalized, and it could be an illness that they're hospitalized, or it could be lack of education. So for my third nursing diagnosis, I put impaired tissue integrity related to diabetic neuropathy as evidenced by diabetic foot ulcer. A diabetic neuropathy patient, somebody who has neuropathy, their nerve endings are damaged and they aren't able to feel sensations the same way that we are. This generally tends to affect them the most in their feet. So if you have your shoe on too tight, or if something's pressing on your foot and you can't feel that, it can really cause the foot ulcer to occur. Something as small as a little cut on their skin can turn into an infection that turns into a foot ulcer that eventually turns into an amputation or worse. So these patients really need to make sure that they take care of their feet. For the patient goals, my first goal is to maintain normal range of blood glucose. This would be a very simply stated goal, but it's going to involve quite a bit of education on what is a normal blood range, how to do that, what kind of medications, how do you control your carbs and your sugars, differences between oral diabetic medication or anti-diabetic medication instead of insulin, or in conjunction with insulin, the different types of insulin. There's so many different types, fast acting, long acting. When do you take them? How do you check your glucose prior to? So these are all really important things, along with educating the patient on the importance of keeping glucose within normal limits, and why having your glucose levels outside of normal limits is, in the long term, really bad for you. So yes, we are going to implement this plan, and you can evaluate it by checking the patient's blood glucose levels. Have them keep a diary, and then you can watch how they make sure that they write it down. It's going to remind them to write it down. It's going to help you to be able to see that they are keeping their glucose levels checked. And another thing, you can check their HbA1c, which really shows more over a period of a couple months, like about 3 months, of how well they've been maintaining their glucose levels. For the next patient goal, I put prevent neuropathy complications. That's if the patient does in fact have neuropathy, but still, even so, you want to educate them on the importance of foot care. So like I had said prior, that most of the neuropathy complications have to do with the feet. So we're going to educate the patient on foot care, inspecting their feet daily. We're talking in between cracks. We're talking on the bottoms of their feet, wearing socks and shoes when they're walking around, not having them go outside barefoot. That's a big no-no. Having their feet well taken care of in regards to their toenails. They need to cut their toenails straight across. So yes, we're going to implement that, and we can evaluate it by having them give a verbal read back, having them even show. It doesn't even have to be verbal. It can be a physical show back as well. So have them show us where they're going to look, and have them explain why it's important that we keep their feet pristine. And then of course we can check their feet as well. So the third patient goal that I put is to take their medication exactly as prescribed. And this can be a large undertaking for diabetes because you have patients with every different kind of plan of care and all the different kinds of insulin, because nobody is exactly the same. And keeping your insulin under control, or keeping your glucose under control, it's an art and a science. So, especially for somebody who's just started off being newly diagnosed with diabetes, we as a healthcare team aren't going to be able to get exactly how their body is going to maintain their glucose levels. So there may be adjustments. They definitely need to be educated on what the different types of medications do. Oral anti-diabetics, insulins, and the different types of insulins that you can have, how you administer them, things like that. So we're going to do this by medication education on insulin, the glucose monitoring, signs and symptoms of you took too much insulin, so hypoglycemia. You want to teach them about, when do you call 911 and how do you recognize that you are hyper or hypoglycemic, and also making sure that they keep everything written down, having their medication regimen written down, so they not only give a verbal but actually have a copy of their plan of care is vital for these patients. Yes, we're going to implement that, and we're going to evaluate it by checking their HbA1c, checking their current glucose levels, and making sure, again, the verbal readback for this would be a great way to continue evaluating, making sure that they understand. So there is a care plan on diabetes. Thank you.
Visit nrsng.com/nursing care plans for our huge free care plan database, and nrsng.com/care plan template for our editable care plan template PDF. This has been another episode of the NRSNG podcast. Thank you for joining us, and thanks for being a part of the NRSNG family. Now, go out and be your best self today.